The following special presentation of your Hometown Health Connection Community Conversations, Heal, Talk, Act, is presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, BestSelf Behavioral Health, and WBBZ-TV.
Hello, I'm Sandy White with John DeShulo. The murder of George Floyd and the racially motivated shooting in Buffalo targeting African Americans has shed a bright light on the significant trauma experienced by African American males, the challenges of staying safe, and in some cases their reluctance to seek mental health support when they need it due to stigma.
Howard C. Stevenson is director of the Racial Empowerment Collaborative at the University of Pennsylvania and a national expert in helping people of color address and heal from racism. Now, he talks about the importance of creating opportunities that make it easier for black men to talk about their trauma. Stevenson says if a black man is able to find a treatment that is culturally responsive, that he understands and that embraces the uniqueness of his difference, he is more likely to use that service.
As a result, many psychologists are suggesting interventions that can create those opportunities, such as conversations at community barbershops, outreach through technology, or social media and national networks devoted to facilitating black men's mental health and well-being.
Now, on this program, we're going to discuss this important topic with our guests. Elizabeth Woike-Ganga, President and CEO of BestSelf Behavioral Health, Kevin Beckman, Vice President of the Health Home Program at BestSelf Behavioral Health, and Takesha Lenard, Family Nurse Practitioner and Medical Director of the very prominent Jericho Road Community Center. And Sandy will kick it off, and we welcome everybody to the program.
Takesha, you are the mom of 4 boys who I understand feared for your safety right after the shooting. Can you talk about your sons, their ages, and share their reactions to the racially motivated shooting at the Jefferson Avenue Tops on May 14th?
So I'm blessed that I have actually 5. So there's 5 boys. My oldest is 20, 18, 16, 14, and then I have a 9-year-old. So as you can imagine, it was just very traumatic for them, just hearing about the shooting and then having their mom within an hour of the actual shooting going onto the scene. Trying to explain to them that it's not work for me. It's where I felt I needed to be in that moment. And there was nowhere else that I rather have been than right there supporting the families as they found out the news about their loved ones. But you know, my role is a mom first, and I intercepted a text message between the boys that was very concerning about their mom, and we didn't know what was going to happen, and so we didn't know if there were more people coming. And so having that conversation with my boys, where I just sat down and explained to them that, you know, I feel that God is going to protect me, but mommy needs to do what she has to do, and them knowing and being aware of who their mom is before this even happened, gave them a better understanding of why I needed to be where I was. And so,
do you remember anything they asked you or said to you?
Well, some of the concerns were, some of the statements in the text message were, well, it's not fair if we lose our mom because she's out there in the community and, you know, someone might target her. I mean, our pictures were, you know, all over the place, and my husband was there as well. And, you know, and they're children at the end of the day. Absolutely. And so, you know, just being cognizant so that even though my purpose and my calling was to be in that community at that time, like God put me in charge of these 5 young black lives that I needed to nurture, and I needed to kind of dismiss some of that fear, because there was an overwhelming amount of fear amongst my boys. And so a lot of the conversation was, why, Mom? Why does it have to be you? Why not someone else? And I took that time to talk to the boys about what my purpose is and what my role is in being in that community. And that is to support them just the way I support you at home. But I also reassured them that mommy's gonna protect herself. I'm gonna look around, I'm gonna check the environment, I'm gonna be as safe as I can. But at the end of the day, this is God's plan and this is where I needed to be.
Did you fear for your own life?
I did not. And I know that probably sounds a little bit different coming from the fact that I was there within an hour, but I didn't. I honestly, I think when you rush into that moment, the fear was not there. It was just a matter of what do I need to do in this moment right now? And I couldn't let fear control that action. And to this day, I never have. I've been at the scene many times and I don't feel fear.
Takesha, you mentioned you had shopped many times at that Tops, and before our recording here in the studio, you said that it could have been you, could have been anybody in your family.
Absolutely, it could have been one of my boys, and it could have been one of my patients. So when you think about the care that we provide on the East Side, anytime you hear about something going on the East Side, the first question is, I have to check. Is that my patient? Is that someone I love? Because your patients become your family.
Yeah.
The reason why I went there is because I wanted to know if there's a patient that I took care of or that a child that I took care of, I wanted them to know Takesha is right there on the scene to support you, whatever this outcome is. And so I had to be there for that.
Liz, you have children of color, and explain your unique family situation, how it relates to the discussion.
Yeah, I have a little bit of a different family situation. My husband is from the Republic of Congo, and we have 2 children, and we do live out in the suburbs. But because of how society is set up race in the United States, my children identify as Black, and the society sees them as Black. So my role as a white mother, I think that having a white mother definitely confers some privilege to my children, and at the same time, they are considered Black in our society. So my job as a white mother is to make sure that they are aware of the race dynamics in our country, and that I educate myself and stand up for my children and make sure that they understand the history of race in this country and how it impacts them, and that I don't go in saying, we're just going to be colorblind in this family or something like that. I think a lot of people would like to think, I'm not racist. We're colorblind, but we can't be colorblind. My children are Black in this country, in this society, and so I have to do my own work and make sure that I understand what that means for them and that I talk to them about it and have courageous conversations.
How old are your children?
My son is 16, he's a junior in high school, and my daughter is 12 and she's in middle school, 7th grade.
You mentioned something interesting, that the issue of racism here is very different than it is where your husband's from in Africa.
My husband actually doesn't have, because he didn't grow up in this society, he came here in his early 20s, he actually doesn't have the same sort of, because he didn't grow up here, he doesn't have the same perception of race. He didn't grow up with racism in his culture in Africa. So that's an ongoing conversation in our family, and it's an interesting one.
Yeah. It's hard to navigate. I mean, to tell children that you are less than in society, but as a mother, you don't say that, I know.
Oh, no, of course not. But, the reality is there, and I think each child kind of sees it in their own way. So my daughter is quite more politically active than my son, who kind of is quieter. So it's personality as well.
Kevin, can we talk for a minute?
Absolutely.
Tell us a little bit about your life and your own upbringing.
Thank you. So first, I just want to say thank you to Liz for seeing color, right? So I appreciate Liz for her willingness to see me and to see me for who I am. So I have to start by saying thank you for that. So growing up, I'm a lifelong resident of Western New York, Buffalo area, and growing up was a wonderful childhood. I have to mention my sisters, whom I affectionately call the Beckman girls. So having 4 sisters growing up as the only boy was a fantastic experience. So
I just love that about you, the fact that you just speak that.
yeah, absolutely. So if I were to not mention them, I
They've trained you well, right?
yeah, I would be in trouble. So I have to thank my sisters growing up. So growing up in Buffalo as a black male, I distinctly remember my parents having a conversation with me about how I am to conduct myself. My mom specifically would say things like, "You're not going to embarrass me in public." And then she would say, if there's any dialogue, I would say it was dialogue because I was kind of chatty. She would say, "Well, your father was going to continue this conversation when he got home. He worked for Bethlehem Steel." So I remember my bedroom faced the driveway, and I would see the lights, hitting the driveway, and me becoming nervous. So growing up it was not unlike the way that Liz is raising her family. Or anyone else. So it was actually pretty decent growing up.
Did you ever have a problem when you had to worry about how you were perceived?
Absolutely.
Was race an issue?
Absolutely.
Did you have to confront it? Did you have to confront anyone regarding it?
Absolutely. So it's yes to all of those. And I wanted to start with the way I grew up because it was normal, at least the way I perceived it. And then it was as I started to navigate the larger community in the larger world, as we started going to the mall and as we
sensed something.
We started sensing something, and then into college, and then when we started driving and we would go to bowling alleys, because in the community, I didn't realize that it didn't have those resources, that infrastructure. So my friends and I would always have to go to the outlying suburbs, and then that's when we started feeling some of those differences.
What did you encounter?
Well, the typical stuff. Typically, someone grasping their purse, or someone.
And you were just standing there.
Oh, you just walk in the room. It's almost a knee-jerk reaction. You walk into the room, and it's the clutching of the purse. It's the gathering your things. It's the what I call squaring up the shoulders. You walk in and someone, can I help you? I'm like, I'm just looking around. I'm here in JCPenney's and I just want to, look for a polo. And it's immediately someone following you, right? Later on, I learned that it was actually other groups who were shoplifting more, right? They would see someone African American walk in the store, know that all the eyes are on me or on us, then they go and shoplift because you're too busy watching me. And I would go, "Man, you have nothing I want," right? I don't. I do well, my sisters and my parents, and now my wife and my daughters. And I say my daughters because my daughters work for Old Navy, and they bring me home stuff, right? Even this shirt, my daughter was like, here's a new shirt, and this is the shirt that you have to wear today. So being the only boy, there were some privileges, but absolutely, as I started to interact and intersect with the greater community, the differences were made known to me. Complete opposite of Liz's husband's experience, right? So he's comes into a society now here where it's more than apparent that those differences are highlighted.
I was going to ask about, we were talking about Liz and her family, and we talked about racism. Let's talk a little bit about some of the things that you do at BestSelf Behavioral Health, which is mental health services.
Absolutely.
Are you seeing an uptick in that, Elizabeth, since the shooting overall?
Yes, I think Kevin can speak to this as well, but the Black community in Buffalo has been historically underserved in terms of mental health services provided by people who look like them. So at BestSelf we've really made a conscious effort, an intentional effort to increase the diversity and the race diversity, especially of our clinical staff, so that we can have counselors who are able to be culturally responsive to the community. So because we do have that staff on, at BestSelf, we have received quite a few referrals from the community and really been able to respond to them well. And I think, it also impacts the greater community. So all of our therapists have had to be trained and, coached on how to address this issue with the clients that they serve as well.
Go ahead, Cindy. I was going to say we're already halfway through the show already. Right. We have so many things to touch on.
Well, we wanted to follow up just with regards to the shooting, Kevin, and the fact that you are so adamantly involved and intimately involved in the community, and you helped and spoke with the people in the aftermath of the shooting. What was that like?
Words cannot describe the feeling. So I too responded within an hour of the event. And my family, my daughters were also worried about me in a very similar fashion as a black male. So often talk about, you know, the figurative target placed on the back when I talk about those knee-jerk reactions going in the grocery stores and the supermarket and all of the, it's the phrase is now, you know, while being black. It's driving while being black. It's grocery shopping while being black. Recently heard of a African American male being arrested in the South for watering his neighbor's
I
flowers,
heard about that
right?
story.
So you can't even take care of your lawn
In fact, I
now.
saw the video on
Right.
Facebook, and I just said, this is surreal here.
Right. So what we walked into immediately after that, all of that was weighing on me, but I couldn't stay home. I had to go and I had to respond and I had to see what we could do to help the community because that was my community. I live 4/10 of a mile from the site. So we wanted to respond to the event. And very similar to what Liz spoke about earlier, when we were at the Mikowski School, individuals wanted folks who look like them to respond.
I heard about this.
Right?
Yeah.
So folks, sometimes people were asking me, you know, well, who in the community asked for the folks who were victimized of the racist shooting wanted folks who looked like them to respond. So we had a diverse group of responders, but it was who was doing what and when, right? Because it didn't happen in a vacuum, nor will the response happen in a vacuum, right? We needed all hands on deck, right? So we had white allies as our, we affectionately call them in our racial equity and inclusion work, you know, who was there doing other things, passing out water, helping food, supporting us. So our response was very robust. From the beginning, and the community wanted this. And we're still on scene even now, like you talked about, you know, so we're still providing services in the community.
It's very important that those services continue, and it will change, I think, in time. And Elizabeth, I know you have something that's called the culturally sensitive therapy that BestSelf offers. What is that?
Yeah, so, you know, treatment, when you're talking about mental health, behavioral health treatment, we really want to make sure that we're being culturally sensitive or culturally competent in everything that we do. And that's really about, you know, recognizing that people come from certain cultures and making sure that you ask them about that. And, you know, what is it that you want? And I do want a counselor that looks like me, or I don't want a counselor that looks like me, or I want someone from my community, or I don't. And it's really just asking and then trying to help people find the supports that they need. And, you know, if a counselor's not available, then just coming from a place of humility where you say, you know, I don't know much about your culture, so please tell me more so that I can be most helpful. And how can I, you know, weave whatever values or cultural values you have, you know, into the work that we're doing together.
Liz, I think our questions are different too. You know, as a family nurse practitioner, now as a psychiatric mental health nurse practitioner, my questions to my patients are a lot different. When they're coming in just for their physical health, my first question is always, how are you doing? And what's going on? And you develop that trusting relationship so that they are more open and they're more honest with you. But I have seen since the top shooting, even since George Floyd, an uptick in like people coming in to me directly requesting mental health services, which is why I chose to go back to school so that I can also provide that for our community on the East Side. So. Yeah,
as well. So I'm seeing an increase of, in particular, African American males who are becoming more comfortable with talking about
That's good
some
to
of
hear.
the symptoms of our mental health. So if they're feeling depressed and they're coming in, they're not saying depression, but they're giving us all of the clues. You know, I'm no longer finding interest in the things that I used to do. I'm isolating more.
Are those the symptoms of depression or
those are some of the
traumatic?
symptoms of depression. It runs the spectrum of the disorder, and then we as professionals would differentiate, work with the individuals, ask those questions so that we can see how we can best help them. That's what we do. So we're definitely seeing an increase in folks asking and seeking help.
Tanisha, I have a question.
Yes.
You're a family and psychiatric nurse practitioner, as you've mentioned. And I'm curious as to how you are integrating behavioral health with primary care at Jericho Road.
Yes. So we are definitely blessed that we have behavioral health directly tied into our practice. So right where I see patients, I have a behavioral health social worker, behavioral health licensed mental health counselor right into our pod. So if there's a crisis or a traumatic situation where I need to call them out, I can literally just walk a few feet and have them like jump right in and push into those visits. But again, sometimes because I've been taking care of that patient for the last 12 years, it's me that they want to talk to. It's me that they want to express this, you know, I mean, there are things that they've never told me before over the last 12 years. And now because my questions are different, you know, like the questions are different, so you're pulling out information that they weren't sharing before. And sometimes it takes you to kind of step back and say, you're not taking your blood pressure medication. Let's find out why. Because it's not that you can't afford them, it's not that you can't pick them up. So what else is going on? Let's figure that out. So because of these situations and the trauma that the community has suffered, my whole line of question is different. And the last thing that I will say is everyone, no matter where you are in healthcare and society, should be trained in mental health and how to care for our community mentally, because we are not asking the right questions, and sometimes those answers are not just going to come. You have to ask the question.
Do you think that fear is morphing into depression, that the fear that some people have as a result of the racism overall, this top shooting sort of exemplifying that?
It's racialized trauma,
Yeah.
and people have internalized that, you know, over the years, even handed down through generations.
Correct.
You know, there's research that shows that it's handed down
Absolutely.
through genes now because of people being exposed to so much trauma, especially in this country because of the racial situation.
Takesha, you mentioned something about your sons, and you had some strong feelings after the Floyd murder.
Yes.
And I'm curious to see if your sons are going through the same things that Kevin went through, where they feel targeted.
So I wouldn't say that my sons feel targeted, and the reason why I say that is because we have those conversations at home, and my sons are very vocal. If they even feel like an iota that something is not right, or they don't feel comfortable in their situation, and they also have parents and friends, white, black, and other races, that are very supportive of their plight. Like when my kids come home from school, or they have interacted in a negative way with someone, my sons have already learned how to speak up for themselves. My sons have already learned how to protect themselves. And then when that all fails, they come home and they have mom and dad who will absolutely support them. And I'm so proud of that.
If I could add to that, I know the focus is on African American males, but having African American daughters, my daughter's experiences are very similar to her son's, right? They have a completely different expectation from society today, right? So they will speak out. They are calling things out when they see it, because my youngest
that's
daughter,
healthy.
it is very
Absolutely.
healthy,
It's
right?
a safe
Don't
space.
keep
It's
it-
a safe
yeah,
space,
that's
right?
safe.
Right. So the work that we are doing at BestSelf is actually rippling, I believe, throughout the community, right? Because my daughters will absolutely say something. They have a totally different expectation.
My daughter too, wow.
Oh my gosh. Oh yeah.
But you
absolutely.
notice it in youth in general now. These students and these our youth and our teens, they're not sitting down quietly anymore. I mean, they are the biggest voices. They have their platforms, including social media and things like that, where they can speak out about what they believe. This is what's going to shape our future. We have to pour into making sure that their mental health is positive, so that they can continue this fight when we're all done.
Absolutely.
Done fighting.
Absolutely.
And
Absolutely.
social media can play a key role, you said, in terms of them communicating one with the other about what's a concern to them.
Absolutely.
I mean,
Sure.
not always, but
It can be a good platform as long as it's, safe and there's no
Absolutely.
trauma coming along with it.
Yeah.
Correct.
Right.
We have
True.
about 3 minutes left, and we want to
Yeah.
touch on a startling statistic about suicide with black men. Kevin, what are your reactions to that?
So as opposed to just getting into the numbers, we have to remember that, these are human beings, right? These are, they're men, and they're human just like anyone else, right? So if I could just take a moment, as opposed to talk about statistics, I want to talk about human beings and the people. So if you're out there and you're suffering, you do not have to suffer alone,
Yes.
right? You can come and get the help. We are here to help you. You are not alone. So if you're experiencing some of those things that we talked about earlier, you can get the help. The only way for us to change the numbers is to let folks know that we are here to help, right? reach out to me, reach out to BestSelf, reach out to counselors, right? We are here to help provide support,
What
right?
about
So we're
in
going
the
to change that.
community, Kevin? I mean, just talking in the barbershops, I understand that's also another way.
Absolutely. I'm glad you mentioned that because there's multiple layers, right? So not only is it the barbershops that we can offer help and support, and I recently went through mental health first aid training, and then Kelly Dumas also wants to include some of our churches, right? Mm-hmm. So, you know, in our community, it's called the Black Church. So I come to the Black Church, right? Mm-hmm. And let me tell you what happens at the Black Church. Yes, it does last all day on Sunday, and it will be, and it's noisy, and we sing loud. Yes. However, there's some other things that are also happening there. It's a support system, right? So we can't
always has been a support system.
It is a support system.
Yes.
The Black Church was able to fill the void from some of the other resources that were not in the community, right? Exactly. So not only was it my social club, it was how I learned how to speak. I learned how to give speeches. I learned how to set tables because we had visiting ministers coming in, so we had to set the
so
the
that's
folks
a great
right,
opportunity.
Right? It's a great opportunity.
I mean, in the community,
Yep,
from
absolutely.
the church on to wherever in the community.
Engaging
Just
the
talk. So
resources
what you're
that are
saying,
already there.
engage, but BestSelf and Jericho role play a
Correct.
key role in that.
Absolutely.
And the church is very important, as
Very
we
important.
mentioned. As
Can I
is
say an amen
BestSelf.
to you?
I'm going to say amen to you back, yeah. Now, we're out of time for this edition of the Community Conversation. It flies by so quick.
Yes.
I know on behalf of Sandy White, I want to thank Elizabeth Woike-Ganga, Kevin from BestSelf Behavioral Health, and Takesha from Jericho Road Community Health Center. Now, it's very important that if you have the opportunity to help, particularly with BestSelf Behavioral Health, we want to give you the website, okay?
Yes, yes.
And I'm going to read that to you. It's bestselfwny.org. Yep. And the phone number there is 716-884-0888. And information on Jericho Road Community Services. You can visit the website at jrchc.org.
Yes.
And here's the phone number,
716-881-6191.
Wow.
Sandy, take us home.
Well, it's been wonderful being with you, and we just thank you for joining us. And we will be continuing these important community conversations at WBBZ, produced in partnership with Annette Pender and Buffalo Healthy Living Magazine. So be inspired to make the change, be inspired to have conversations with one another, and thank you for watching.
Thank you, Sandy. This special edition of your hometown Health Connection Community Conversations, Heal, Talk, Act, was presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, BestSelf Behavioral Health, and WBBZ-TV.